All right, so let's look a little bit at the knee anatomy itself so we know where all these structures are. So obviously when we start looking at assessment and also when we start looking at treatment, we know which structures are what. Okay, to start with, let's have a look at the outline here. This will obviously be the outline of our patella, okay, itself. Okay, running off that patella will be the patellar tendon, which comes down and attaches onto our tibial tuberosity, which is basically that really big bump there on the front of your tibia. Now if we go out to the lateral, then obviously we'll have the lateral joint line here, okay, and then coming down on the lateral also we have the ITB as well, which comes all the way down here and basically attaches onto Gurdey's tubercle. Okay, we've also got the bulk of the Vastus Medialis all under here, so it's a large muscle, makes up a big part of this lateral part of the thigh. Then we have Rectus Femoris coming down here, okay, so we have the suprapatellar up here and the infrapatellar there as well. So we can obviously have tendon issues on both ends of this patellar area. Now if we come from the medial, obviously as I mentioned before, you've got those three muscles that attach in here. But for today and what we're looking at, especially with patellofemoral joint dysfunction, it's so important that we focus on a lot of these lateral thigh muscles and the lateral structures themselves. This lateral joint line here, you've got to keep in mind that there is a retinaculum in and around this area as well. So it's a thick band of connective tissue. So that sometimes that actually gets quite restrictive, and that can add to a little bit of the patellofemoral issue. So if we're talking about the actual mechanics and the pathology of patellofemoral joint dysfunction, a lot of the time it is basically a patellar tracking issue. Okay, so there's no mystery to what happens here. Unfortunately, what will tend to happen is these lateral thigh muscles will become quite dominant, and because the patella is embedded into the rec fem itself, what happens is it tends to just be pushed or dragged out laterally, okay, which basically means that the patella then starts to articulate unevenly in the condyles there, and that's what will give us classic retropatellar pain. Okay, so that's pain that is underneath the kneecap itself. Okay, and it is really poorly localized, so it's very difficult to try and reproduce the pain because it's underneath the kneecap itself. So that's your classic retropatellar pain. If we move away from there and then we look at patellar tendon pain, that's really quite easy to assess too, because obviously just pressing down on the tendon itself and running backwards and forwards over it should reproduce a lot of the pain they have. But unfortunately with the patellofemoral, that issue is because the pain is under the kneecap, it makes it that little bit more difficult, and that's why a simple leg squat will more than likely reproduce that pain. Or what we also can do is just press down over the top of the patella and then glide it medially and also laterally, and what you'll tend to find is that can also reproduce their pain, okay, because then you're pushing those surfaces that are unfortunately irritated, and that should reproduce a lot of their pain. So patellofemoral pain, because it's diffuse, a lot of the time, sometimes it can be down here in that sort of infra area. Sometimes it's out in the lateral, sometimes it's the medial, and sometimes at the top. So it varies from person to person, and it will vary from your athletes, your track athletes, to also your athletes that might obviously once again change direction, so they may see it more in the medial than the lateral.